Hello, viewers, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips and Practical Tips. What I'm going to be sharing with you today is a nice example of the recently described microcystic, elongated, and fragmented pattern of invasion in endometrioid carcinoma. So this is a case of a 52-year-old female patient who presented with postmenopausal bleeding and was found to have a large cervicouterine mass. And this is a whole section view of the endomyometrium showing the tumor here, and then invasion into the almost full thickness of the myometrial wall. But the area that I'm going to focus on, zoom in, is this particular area. And just from the scanning power magnification, as if the color of this area is different, more a bluish tinge, and this is an important clue to the suggestion of the diagnosis. And this is one of the discrete foci that I just, in the area that I just showed you, which shows this bluish tinge because of the fibromyxoid stroma, and some vessels, glands are seen in the middle of these areas. And on high power magnification, again, some dissecting fibromyxoid stroma in between the pre-existing myometrial fibers containing these formations, which might be difficult to discern whether these are vessels or whether these are glands. And people tend to think these are like lymphatics or vessels because they are flattened and thin-walled. And on even higher power magnification, we have the fibromyxoid stroma, fibrous tissue growing along with a lot abundance of myxoid, bluish tinge myxoid stroma, along with a large number of inflammatory cells, mostly neutrophils. And then we have these formations of what might be thought to as glands or vessels. People most often mistaken these for vessels, in particular lymphatics. And the reason for this is these are not usually clear. They are lined by a flattened, a bland-looking epithelium. This is another focus here. And this is the typical appearance of the MELF pattern of invasion. If you are suspicious, if you are not sure, what you have to do is to apply immunohistochemistry. This is another focus where we have, this is a different focus where we have the same, this discrete, separate focus of fibromyxoid stroma with this bluish tinge, and then some scattered atypical cells. But this is really very important a formation which looks like a vessel or a lymphatic. It is actually a gland lined by flattened, bland-looking epithelium. And cytokeratin 7 is extremely helpful in confirming or even identifying these foci. And as you can see, this one focus contains a large sized gland lined by flattened epithelium. But look at the number of individual cells, and this from here came the fragmented part of the MELF acronym, because the cells tend to frequently appear as individual cells infiltrating deep into the myometrium. And another focus where we have the elongated, they tend to be stretched out, and microcystic because they tend to form this small microcyst appearance of the gland, in addition to the fragmentation where we have some epithelium within the lumen and some epithelium detached away from the lumen, sometimes even forming small groups on the H&E. Frequently, these cannot be really identified with confidence. And look at the flattened epithelium here, and on high power magnification with cytokeratin 7, these are easily missed or misinterpreted as a part of the fibromyxoid stroma or even vascular channels. And another focus, a third focus, showing the same, an elongated gland tendency at the microcyst formation, and then individual tumor cells just separating, detached from the main focus of invasion. This is the typical appearance of the MELF pattern of invasion, and cytokeratin 7 is usually extremely helpful in identifying this pattern of invasion. So the final diagnosis in this case is endometrial endometrioid carcinoma with MELF pattern of invasion. Remember that this is a peculiar type or pattern of invasion that we identify usually at the advancing edge of the tumor. So it's not within the tumor, it's rather at the very advancing edge of the tumor. It's important to identify in order to be able to measure the depth of invasion of the tumor, the real depth of invasion of the tumor. Remember that the MELF pattern of invasion is an epithelial pattern of invasion. It looks like similar to lymphatic invasion, but in itself is not considered to be a lymphatic invasion. On the contrary, this is epithelial invasive pattern. It is associated with an increased prevalence of lymphovascular invasion, but this is completely separate. Please remember that when with MELF pattern of invasion, you have to examine your lymph nodes carefully if really submitted with the hysterectomy specimen, because the metastasizing epithelial cells tend to be really bland-looking, histiocyte-like or squamous-like, and can be easily missed, where you can also apply cytokeratin 7 even to the lymph nodes to help you in identifying the metastatic tumor cells. I hope you find this tip useful in your daily practice. Thank you.